everybody. So we are going to talk about the cardiovascular system. This is a shorter lecture, but we're going to get right into it. So let me share my screen with you. Okay, so coronary heart disease is a cardiovascular disease, which is a term that encompasses many diseases that affect the heart and the blood vessels. According to the most up-to-date data from the American Heart Association in the US, someone dies every 34 seconds as a result of cardiovascular disease and every 3 minutes and 11 seconds as a result of stroke. Hypertension, oops, skipped a couple there. All right, so coronary heart disease is also called coronary artery disease or CAD, you'll see. It is usually caused by atherosclerosis in the coronary arteries. Atherosclerosis is hardening of the arteries where plaque forms within the blood vessels. There are numerous factors that can predisposition someone for being at a higher risk for coronary artery disease. One of these is elevated cholesterol levels. There are four major types of lipoproteins, but the HDL and LDL are the two that we're going to focus on because they impact heart disease. So HDL, which is high density lipoprotein, is also known as the good cholesterol because each molecule is made up of about 25% cholesterol. The HDL molecule transports cholesterol from the tissues back to the liver for metabolism or excretion. If someone has low HDL levels, the best strategy to fix this is to lower their LDL. Encourage weight management if they're overweight, smoking cessation, and increase exercise. These are all things that we know reduce the risk for CVD, independent of the effect on HDL. Smoking harms almost every organ in the body. It contributes to narrowing of the arteries, lowers HDL levels, and promotes clot formation. LDL, which is low density lipoprotein, also known as the bad cholesterol, because these molecules contain approximately 50% cholesterol that has been produced in the liver. When someone has a high level of LDL cholesterol, there's a higher amount of cholesterol hanging out in the vessels, which can cause an accumulation, creating larger fatty streaks that can harden into plaque. That narrows the arteries and minimizes the amount of blood that can flow through those vessels and then to the surrounding tissues. If the plaque is large enough to completely block an artery, or if part of the blood blockage breaks off, this triggers the formation of a blood clot called a thrombus. And then when this clot breaks away, this is called an embolus. An embolus can travel to another area of the body, causing an MI, myocardial infarction, heart attack. It can also cause heart, stroke, so it affects the brain, pulmonary embolism, so a PE, which is the lung. Diet and lifestyle changes are key to preventing and treating heart disease, and medications can be added for higher risk groups. So, heart healthy diets, such as the DASH and the TLC, which is the therapeutic lifestyle change diet, are balanced and are nutritionally adequate to help in maintaining a healthy weight. Also helps to maintain normal lipid levels, blood glucose, and blood pressure. A healthy diet and a healthy lifestyle lower the risk of coronary heart disease. Trans fats are known to increase LDL levels and increase inflammation, therefore increasing the risk for heart disease. Trans fats are found in partially hydrogenated fats used to make commercially fried and baked products like margarine, shortening. Saturated fats also increase LDL and total cholesterol levels. These can be found in meat and dairy products. Choosing lean meats such as skinless chicken and fish should be substituted in place of red meats. Even lean meats have saturated fat, so portions should be kept at about 6 ounces or less per day. Also, choosing lower fat cheese and dairy products is a healthier option. Total fat intake is recommended at 25 to 35% of the total calories per the American Heart Association. Increasing fiber with fruits and vegetables and omega-3 fatty acids like fish oils lower the risk for cardiovascular disease. Certain nuts and seeds are also higher in omega-3 fatty acids, but they are not as effective as the fish oils. If someone doesn't like to eat fish, like me, they can take supplements that have similar benefits. So hypertension. Hypertension is one of the most common chronic conditions in the United States. It is arbitrarily defined as sustained elevated blood pressure greater than or equal to 140 over 90. The increased likelihood of health problems begins with ongoing hypertension, increasing the risk for heart disease, stroke, kidney failure, and other health conditions. Dietary consumption plays a big role in blood pressure regulation, with diet being the initial treatment before starting on medications. The DASH diet incorporates whole foods, higher in fiber, lower in fat, sugar, and sodium, and has been shown to significantly reduce elevated blood pressure. The sodium in our diets comes mostly from processed foods, so consistent intake of 4 to 5 servings a day of fruits and vegetables, eating whole grains, and 4 to 5 servings a week of nuts, seeds, legumes, that all falls in line with the DASH guidelines. There's also a direct link between alcohol consumption and blood pressure, so limiting the consumption of alcohol can be beneficial. A regular exercise routine has many health benefits. Weight management is directly related to blood pressure control. Weight loss can help to reduce blood pressure and achieve a healthy weight with a BMI less than 25. That is an effective intervention to prevent and treat hypertension. Stress management is also a key element in maintaining blood pressure. So heart failure. Heart failure is also, you'll hear interchangeably, you'll hear it called heart failure, congestive heart failure, CHF. This is characterized by specific symptoms, specifically shortness of breath, fatigue, and edema. Coronary heart disease and hypertension are primary causes, as well as arrhythmias and valve disorders. Risks for heart failure include obesity, diabetes, metabolic syndrome, and previous MIs. The goals of therapy are to control the underlying risks. The DASH sodium diet is appropriate for people with congestive heart disease and hypertension. And while it has not been directly related to benefiting in heart failure, lower sodium intake is recommended, so a sodium-restricted diet would be appropriate. Additional diet modifications include fluid restriction, low-calorie diets, small frequent meals, which reduces the gastric distension and pressure on the heart, and potentially higher potassium foods if patients are on potassium depleting medications like thiazide diuretics or digitalis. Some patients may also have malnutrition issues with poor nutritional intake and long-term medication use. This is called cardiac cachexia. These patients need a high-calorie, high-protein, high-nutrient, yet low-sodium diet. So a couple things to think about. There are numerous factors that can be predisposition someone for being at higher risk for coronary disease. Some of these include genetics, gender, advancing age, elevated cholesterol levels, hypertension, smoking, unhealthy diets, obesity, and physical inactivity. So make sure that you understand the differences between the things that are modifiable and non-modifiable risk factors. Make sure you understand what the differences are. So what are those things that you can change versus the things that you cannot change? You can change your eating habits, which would be modifiable, but you can't change your genetics. So that's non-modifiable. So just make sure you understand the difference of what those are. All right, so let's talk a little bit about metabolic syndrome. A cluster of metabolic abnormalities or conditions that can increase the risk for heart disease, stroke, and diabetes. That's what metabolic syndrome is. The primary objective with metabolic syndrome is to reduce the risk of atherosclerotic cardiovascular disease. The goals include smoking cessation, weight loss, controlling blood pressure, and glucose levels. So let's talk about anemias. So with anemias, there's a few of them, but just making sure you understand the difference is going to be key. So there are different types. Be aware that these are associated with many disorders that we're going to be discussing in the following lecture. But we're going to start here with iron deficiency anemia. So it is just that there's not enough total iron, leading to a decrease in the hemoglobin. This is considered to be the most common nutritional disorder, affecting more than 30% of the world's population. Approximately 2/3 of the body's 3 to 5 gram of iron is contained in the heme portion of the hemoglobin. Iron in foods exists in two forms. You have heme iron, which is found in meat, fish, poultry, and then non-heme iron found in plants. So your grains, your vegetables, your nuts. The majority, if iron, the majority of iron in the diet is non-heme iron. Normally, iron absorption is only about 10 to 15% of total iron intake. The typical diet provides 6 to 7 milligrams of iron per 1,000 calories. Based on absorption rates and to compensate for daily and monthly losses, the recommendation for men and postmenopausal women is around 8 milligrams. And then for premenopausal women, 18 milligrams because they have more increase in iron loss. The increases in iron are needed because of growth needs and in response to heavier chronic blood loss related to menstruation. Could be surgically losing blood, injuries, GI bleeding. Vegetarians, they require a much higher intake due to lower availability of iron in a vegetarian diet. Some people with iron deficiency anemia practice pica. This is when people ingest things that are non-food substances. Ice is typically the most common one that I've seen, but some people may ingest dirt or other substances. This impairs iron absorption. The symptoms of deficiency are similar to the symptoms of iron overload, so it's not recommended to base the need for supplementation on symptoms alone. Iron toxicity can lead to severe health problems, such as heart disease, cirrhosis, cancer, due to the accumulation of iron in the body tissues. Iron is absorbed in the duodenum, so any kind of surgical intervention or anything that affects this area could cause iron deficiency. And again, we'll talk about those kinds of things in the next lecture. All right, pernicious anemia is when there's a deficiency in vitamin B12, causing a lack of RBC production. Intrinsic factor, which is necessary for absorption of vitamin B12 from the intestine, is produced by the stomach. A lack of the intrinsic factor often has an autoimmune component. The intrinsic factor may be absent in gastric surgery patients. And then vitamin B12 injections usually are necessary for these patients. Vitamin B6 deficiency can lead to an increased risk of vascular disease due to an increase in the homocysteine levels, which is a non-essential amino acid in the blood. Deficiency of vitamin B6, these are uncommon, but usually are accompanied by other B vitamin deficiencies. Secondary deficiencies can be related to alcohol abuse because the metabolism of alcohol promotes destruction and excretion of vitamin B6, as do some other medication therapies like isoniazid for TB. It acts as a vitamin B6 antagonist. All right. And then we have folic acid deficiency. So folic acid is the synthetic form of folate found in multivitamins and then some foods. Folate is recycled through the GI tract, so a healthy GI system is essential to maintaining a folate balance. Folate deficiency impairs DNA synthesis and cell division, resulting in macrocytic anemia. Alcoholics are at high risk due to the toxic effect of alcohol on the GI tract. Women of childbearing age, either pregnant or trying to conceive, need to be mindful of folate consumption due to the risk of deficiency being related to neural tube defects, so like spina bifida in infants. It is also important to know that consistently high intakes of folate can mask vitamin B12 deficiency, which can cause permanent neurological damage if it's not treated. And then this just shows a lot of the sources of iron. So just be familiar with these. So that is the cardiovascular system. Thank you.